Good evening, everyone. Please note that the session is being recorded and will be shared in our socials after the event. So with that being said, welcome to tonight's 𝗬𝘁'𝘀 talk, which is part of our technical talk sessions, where it's a space where we celebrate powerful ideas, pioneering women, and conversations that move us forward. At 𝗬𝘁'𝘀, we believe in creating platforms where knowledge meets inspiration, and tonight is no exception to that. With that being said, today we are going to listen to an incredible woman who has dedicated her life to something that we often overlook. We have heels, we have boots, we have techies, we have sleepers, but we don't look at it on our day-to-day lives and the impact that it has in our lives, especially in the mining space and workplaces. Today, I'm introducing to you Dr. Anette Telmo Thompson of the 𝗑𝘗 Group, who brings a unique mix of excuse me, sorry, I was just admitting a few people. She brings a unique mix of knowledge to her colleagues in research, development, sales, marketing teams at BBF Footwear. She holds a PhD in clinical medicine, a master's degree in podiatry, 6 years of footwear in industry training, and 2 decades of continued work experience as the interface between foot health and foot design. Dr. Thompson has been active in the talented BBF development team that incorporates data from her research into PPE that simply fits better. Her postgrad research work in collaboration with the local footwear industry resulted in the first database of foot measurement in South Africa using 3D laser scanning methods. The database grew by collecting foot measurements in industry and mining and is constantly being added to. A published author, Dr. Thompson writes for peer-reviewed medical journals and mass media. Her research into foot axial alignment for footwear manufacture was published in a textbook for economic design. And Dr. Anette was previously active in podiatry education and mentored 7 graduates who later entered private and state medical practice. She has been a guest on TV programs and has contributed to local radio. Her special interests include diabetic foot, the foot under load, and the relationship between foot function, shoe fit, and comfort. It is known that a percentage of workers suffer from foot pathologies, whether inherited variants in foot shape, acquired special needs from injuries, or work demands, or actual medical problems such as excessive sweating, infections, and nail problems. To assist BBF Footwear customers and end users, Dr. Thompson's developed a protocol incorporating visual tools and a means of remote assessment and assistance in finding solutions for those workers who present with foot problems. The BBF FAR system matches the individual foot needs of a complainant with the best shoe fit, provides a medical response to the assessment, and connects them to their nearest occupational podiatrist for specific further medical treatment and assessment that is also needed. With that being said, over to you, Dr. Anette.
I had no idea you were going to have to read out all that thing. I thought that was going to be just published so people could read it, but well done you.
No,
okay, thank you.
The reason I read it out is because I felt I will not be doing justice to you, and I will not be doing justice to the work that you have done. And I mean,
it's been many years.
It's something that we don't look into, so you deserve it.
Oh, thank you. Thank you. All right. So I'm going to just press go and we're going to talk about. So thank you to those who have joined us. I know it's a bit early for some other people, but fortunately there's going to be the recording and then people will be able to access it afterwards. So it's all about your health, ladies, and specifically the focus is the health of your feet. So I know the name for podiatrist in a few languages. So apart from being a podiatrist, you have in isiZulu, you have 𝗓𝗏𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀 𝗓𝗱𝗶𝗶𝘁𝗂𝗁 in Afrikaans, 𝗑𝗲𝗓𝗁'𝗂𝗂𝑚𝑖𝑙𝑒𝑛𝑔𝑖. And I'm sure there are more throughout Africa, but you get the idea. Basically, they are registered with the Health Professions Council of South Africa, just like doctors are. We evaluate, we examine, we diagnose, and we treat all foot and ankle conditions. Some podiatrists, such as myself, are then further trained in research and in the footwear industry. And as women in industry, you have to know that your feet are as important as your hands and your eyes. If you didn't have the ability to walk around, you wouldn't have a job, okay? So podiatry in industry focuses on prevention. We like to do that through education, through foot screening, through surveillance, and then through research so that we can guide, design, and manufacture. Prevention, though, starts with you. You need to check your feet every day. People often say, oh, my feet are so dry, whatever. So that the correct texture for skin in the feet should be not too dry and not too moist. And you need to be able to correct those imbalances. And with PPE, it's absolutely necessary that you wear the correct socks. I know that BBF through Bova and through 𝗚𝗍𝘂𝗄𝘁, the two brands, they have specific socks, and they are quite different to anything else that you would find. So it's a good idea to try and motivate, although it's not legislated that the employer has to provide you with socks. But to me, the specific socks, the technical socks and the shoe form a partnership, and we should just motivate for that. So if you have uneven thickness of skin, you need to file it to prevent corns, because corns are caused by pressure and friction. You need to watch out for color changes. Your skin color on your feet should be the same color as that on your hands. Your toenails should be the same coloring as your fingernails are. If you see anything that's different to that, you need to watch out for dark patches. And then consult a podiatrist if you have foot problems. So what are some of the common foot problems? And I apologize if this is going to freak out a few people, but I see this in the clinic on a regular basis. So there are fungal and bacterial infections. The toenails might be cut too short and can cause ingrowns, or the feet might be too damp, and that allows the toenail to actually bend and penetrate the skin. There might be genetics that would result in bunions or hammer-toes. Your poor fashion shoe choices can also cause the bunions and the hammer-toes. And then, of course, as I said before, compression and friction can cause calluses and corns. So podiatrists are trained to find the cause. True medicine is find the cause and then treat that. Not just like, oh, you got a pain, we don't know what the pain's coming from here, have a prescription for Sindol or something like that. You have to find what's causing pain. So in these pictures, I hope that you can see that the shoe the little beautiful little pink pump is directly responsible for those two corns on her foot. Sometimes it's bone structure, in which case, if you look on the right-hand side of the screen, prescription orthotics, we call those specific inserts that fit inside the shoe. Those might be needed for correction, or we might simply have to correctly measure your foot so that we can get you into the right size shoes to avoid skin friction. You must know that sometimes the PPE sizes are not exactly the same as sizes that are out in fashion. And it's not that the PPE sizes are incorrect. It's that sometimes our fashion is imported, and importers, I know of one huge company up in Pinetown, that their only job is to open container loads of shoes, fashion shoes, and remark the sizes, because unfortunately, somewhere across the ocean, they get the size marking wrong. And so these people have to resize the shoes. So it's quite possible that you'll find that you might be a 5 in fashion shoes, but you're actually a 6 in PPE. So we find the cause and then we treat the cause. So also we are qualified to use local anesthetic in the consulting room generally, and sometimes people request that they actually be taken to theatre to remove an ingrown toenail, and we'll do that as well. But generally, it's quite easy to do in the rooms, because once you've had your local anesthetic, just like being at the dentist, you don't feel anything while we are reshaping it. It's not necessary to remove a toenail, although we know and we are trained how to do it. Usually that's a last-ditch effort, or if it's been a serious accident or something where half of the nail has been ripped off, then we will remove it. We also remove plantar warts, and we clean all the dead skin around wounds like ulcers and abscesses. But of course, this is always preceded by finding the cause of the problem. Many women in industry suffer from heel pain. I've just picked one thing to go into detail, okay? And there are many causes. Now, this is a busy slide, and so I'm just going to go through it. So plantar fasciitis, anything that ends in the word itis means inflammation. So that's an inflammation of that plantar fascia, which is the top picture. You can see that it's like a huge big rubber band that goes from your heel bone right through to the front underneath the toes. And when it's inflamed, you get immense pain under the heel, under the middle of the foot, and sometimes under the ball of the foot as well. It can be caused by overload. It might be caused by overuse, in other words, repetitive strain. You may be picking up weights that are incorrect for your body. And if a plantar fascia is irritated for long enough, it can actually lead to a heel spur, which is then a bony outgrowth that comes from the calcaneal bone. Poor foot posture can cause this heel pain. In other words, a person might have a fallen arch, like a flat foot, and that can cause a twisting of the foot, which then results in more tension underneath that plantar fascia. You might have a tight Achilles tendon. You might have tight hamstring muscles. There might even be a bursitis. A bursa is a naturally formed pad that is in between tendons and muscles and tendons and bones, and there might be an inflammation in that. In some people, as they get older, your natural fatty pad, and I know everybody freaks out when you hear the word fat, you have natural padding underneath your foot. But as you get older, and sometimes when you have arthritis, that fatty pad can atrophy, which means it can thin and it can reduce. And then, of course, you feel as if you're walking on bones because you haven't got your natural padding. There might be stress fractures. People might have taken part in, we had one the other day where a lady decided she was going to try and play paddle for the first time without doing any proper training. She ended up with a stress fracture. A neuroma might be an overgrowth of a nerve that's being pinched because the shoes are too tight. And then, of course, there's arthritis, there's age, where we have wear and tear on joints and tissue. And of course, a very, very important one is footwear. Wearing tight shoes or not having any cushioning inside the shoes. And of course, that means that we have to be conscious of the shoes that we wear outside of work as well as our PPE. So I just wanted to put a little word of caution there. A lot of people will quickly go for painkillers and that kind of thing, and anti-inflammatories. And doctors are very quick to prescribe anti-inflammatories as well, and you can buy them over the counter, something containing ibuprofen. But if you take it for an extended period, in other words, for more than a month, it can actually damage your kidney. So please be very cautious about anti-inflammatories. Rather go and find out what is causing this inflammation and get that treated, not just shove painkillers at it. So find the cause and treat the cause. So I just wanted to put a little note in here, which is that when we talk about shoe fit, naturally, in other words, without having any swollen feet or anything like that, your feet will naturally increase by 7% in volume after 4 hours of activity. So your morning foot size is not your afternoon foot size. If people sometimes put on their shoes and they feel, oh, it's a bit loose, it won't be loose by the afternoon. How many of us get home at the end of the day and we can't wait to chuck our shoes off? Well, that's the reason. So talking about fit, what's really important is not only that it has to be long enough, but it has to be wide enough. And if you're in doubt, you rather fit to the width. In other words, you might be a 6 in length, but you're a 7 in width. You rather wear a size 7. You can always put an extra insole or an extra footbed inside the shoe to fill up the space and give you a little bit more cushioning, but don't skimp on the width, okay? Because that's when we have problems. If you look at the picture with the red arrows, you will understand that if you put load on your foot, in other words, if you're going to pick up weights, if you're going to move things from side to side, that arch will lengthen. So you also have to allow for that in PPE. As you're walking, you're busy, you're active during the day, you need to allow for that foot extension of length. And then I have 3 little pictures in there, which you can examine at your leisure. But basically, you can change the way your laces are done so that you can cope for wide feet, you can cope for high arches, and you can cope if your feet are narrow and your heel is narrow and it's slipping out of the shoe. What else changes the fit? Pregnancy does, okay? So in the first trimester, there will be swelling of your feet because you now have increased blood volume and you end up with tired, achy feet. In the second trimester meaning 3 months, okay? So in the second 3 months, you're going to be carrying more of a load, so you're going to feel pain in that arch. Your feet are flatter. Remember, I spoke about the increased foot length. And then you might have overpronation where you're not balancing 100%, and so you're rolling your feet either to the outside or to the inside. In the third trimester, you might experience severe swelling. There'll be pressure on the veins because now baby is sitting on the veins that are in your pelvis, and you will probably have a touch of plantar fasciitis and ankle instability. After the birth, the pain may persist if the foot is not supported, and you might have changes in foot shape. In other words, there is a hormone that is released just before birth in order to naturally allow all of the tendons and ligaments to stretch open. That hormone is called oxytocin. And after birth, sometimes it's not resorbed at the same speed, and where you might have been a size 5 before you had your baby, you may end up with a size 6 and it won't ever go back to being a size 5. You need to be aware that that might happen. And just for fun, I thought I'd put in some pictures of what babies' feet look like from the 24th weeks through until the 40th week, and look at how in those weeks, how the foot actually doubles in size. I need to warn you about this. Diabetes is now the number one underlying cause of death in women in South Africa. And this was published as long ago now, 3 years ago, in 2022. How many women in industry have diabetes? How many women in industry have diabetes but don't really realize that they have diabetes? If you find that you're always hungry, that you're constantly thirsty, that you're frequently having to go to the toilet to pass urine, you might have diabetes. I'm hoping that general screening of diabetes takes place throughout industry, the same way as industry screens for vision problems, screens for TB, screens for blood pressure, and that sort of thing. They should be screening for diabetes as well. So what are the complications of diabetes? If we ignore all the other ones, the very serious ones up in the top of the body, and you look down at the feet, you can have nerve damage and you can have loss of circulation. Both of those things, where you don't have enough blood going through your feet and you have nerve damage, can lead to amputation. On the bright side, research also shows that up to 85% of diabetes amputations can be prevented by a once-a-year diabetes foot screening done by a qualified podiatrist. So a once-a-year foot assessment, and it consists of 6 parts. I'm going to go through those parts quickly. What should be checked? Musculoskeletal, dermatological, vascular, neurological, footwear, and then we also impart education. So what do we check? In musculoskeletal, we check a foot for stiffness. We look for alignment. We look for ranges of motion. Is the foot functioning the way it should be? In skin and nails, we look at texture. Is it too damp? Is it too dry? Is there infection in the nails? Is there infection between the toes because there's too much moisture and it looks soggy? And that is very easy to pick up an infection between the toes if that happens. We check nerve sensation. We check for sensory things such as touch, vibration, whether you can feel the difference between cold and hot and feel the difference between sharp and blunt. We check blood circulation in the feet. The bottom picture showing an instrument, that's actually a Doppler instrument, and we can listen to your pulses. You can see a little picture there showing your pulses, and that tells us, is enough blood getting to your feet? Are your veins congested? And then we look at shoes and we figure out, we'll measure the feet and find out, are you actually in the correct size shoe, and assess it. And then we empower the patient by talking about foot care and what to do. In all of that, when we find that there are little problems or potential little red flags, then we'll classify the foot in terms of how risky it's going to be for a future possible ulcer. And that will classify into high, moderate, and low amputation risk. So some of the common diabetic foot problems, they're common to other people as well, but they're very, very scary for people who have diabetes, is a bunion, because a bunion will be much more prone to be the site of an ulcer, because you can imagine that's rubbing against a shoe. And if that breaks the skin and creates a sore, which we call a diabetic ulcer, that would be one of the first places to do it. Callus, areas of thickened skin, which is produced by pressure or friction. And then cracking of that callus can allow entry of bacteria causing an infection. The corns or the hammer toes, people who habitually wear high heel shoes, your foot's going to slide into the front of the shoe, and then the toes will bend, and you will end up with corns on the top of your feet. Toenails, ingrown toenails. Again, if shoes are too tight outside of work, or the wrong shape, putting pressure on the side of the foot so that the nail actually penetrates the skin. And then dry skin, when glucose levels in a diabetic are too high, they can become dehydrated, and that can lead to dry skin on the legs, the feet, the elbow, which then easily cracks and is easily infected. In fact, there are lots and lots of different heel balms and things that could be used if you have dry skin, if you're diabetic. And then ultimately the one that we are always trying to avoid is the ulcer, anywhere on the foot, but often at a site of injury or pressure. So overseas, they came up with the words ACT now, and those letters 𝗚𝗚 obviously stand for avoid accidents, look out for changes. Okay, change can be pain, it can be color. Look out for changes in temperature. If one foot is suddenly hotter or colder than another one, that indicates something with blood circulation. Is there a new pain in your foot? Do you have a wound? Is it actually oozing? And then obviously we need to do wound care. And it changes. Sometimes it's more visible depending on skin color. And I'm going to go back to the other one there. You just have to, you yourself know what your skin color should be. As I said before, compare your hands to your feet. The color of the skin on your hands should be the same as the color on your feet, and the same with nails. Your fingernails generally are not the ones to get infected, and they should be the same color as your toenails. Then the last thing that I need to advise on is that it's now been shown over and over again. There are so many scientific papers shown that exercise is medicine, especially in the world that we live in today. And the best exercise for feet is walking, if possible, in flexible shoes. So you might have specific foot exercises that might be needed to prevent slips and falls. If you are unable, for example, to balance for 30 seconds on one foot, then your ankles are weak. And it's a good idea to do these exercises. So toe curls, okay, ankle rollout, inversion, eversion, that's rolling your foot in, turning it out, turning it inwards, rotating your ankle, pointing your toes. You don't need the ball really, but it does help. You can pretend to be ballerinas, sit on a chair and point your toes and stretch them, hold that stretch, and then point your toes back towards it. That's what it means by flexing toes, where you then pull the toes back towards you. And then your balanced challenge. This balance challenge that is in the little picture on the bottom of the screen is a different balance challenge. This one is where you can go up onto the front of your foot and see if you can hold that for 15 seconds before you roll back down again. This is a real challenge. We all think we're fine until you actually try standing flat foot on one foot for 30 seconds and see how strong your ankles are. And when we have strong ankles, that's when you don't slip and fall, because your muscles will instantly react, and you'll be able to save yourself and prevent a fall. So there are effects of muscles on foot posture. And so I've just been talking about muscles in the ankle, but also we as women have a wider pelvis than men. And we don't realize that the muscles in our thighs and our legs also have an effect on our foot posture. So again, walking, doing exercise, all of that helps to strengthen up our lower limbs so that we can have better foot posture. And outside of work, a podiatrist will examine your foot posture and type and advise on shoes. You need to also be very careful about the kind of shoes that you wear outside of work. it's better to be in shoes that are not high heels, because you change all kinds of, you change your center of balance, you change the way the muscles fire. It's better to be in a lower heel. If I can show you, I hope you can see my little picture. 2 fingers. So 2 fingers should be the heel height, maximum heel height that you wear outside of work. You should always treat, if you've twisted your ankle, you need to get that properly seen to. You need to have physio afterwards to rehabilitate that. And if you have any imbalances, like some of them shown here, where your feet are either rolling outwards or rolling inwards, those can be corrected by means of prescription inner soles or orthotics together with exercises. So these are some examples of what a functional and an accommodative orthotics look like. That's a picture of one of our colleagues having a look at somebody, how they walk, because we learn a lot that way, to watch how your ankle behaves, how your foot behaves. And then we can take what we call a slipper cast or a foam cast, and we can actually make custom orthotics, which can help keep you balanced. And at the same time, we would recommend appropriate footwear. Where podiatrists are trained at university, we actually work in little workshops with machinery and grinders and baking ovens to actually learn how to make these things. These days, I'm spoilt. I send my prescriptions off to a laboratory and I get them made that way. And quite a few of our colleagues do that as well. The ladies are not so keen on getting glue on their fingers. So I think most of the lady podiatrists send it away to some of the male podiatrists who run laboratories. So where do you find a podiatrist? Okay, so you can Google podiatrists and the name of your largest, nearest town, and you should be able to find a podiatrist. But we work in various settings, including private practices. We work in hospitals, in clinics, and we work at academic institutions. The training for a podiatrist in South Africa is only at one university, which is a crying shame. It's the only university in the whole of Africa that trains podiatrists. I wish this would change. And it's at the University of Johannesburg. Some large industries actually employ a podiatrist in-house, or they contract them. Some podiatrists, I know some of my colleagues, are even flown to remote locations. For example, I've been up to Botswana, the diamond mines. There are colleagues who go to the mines in 𝗏𝗏𝗃, even some who go out to the oil rigs at sea in Namibia. You don't need a referral from a doctor to go and see a podiatrist. However, we often collaborate with other doctors and healthcare professionals to ensure that you get comprehensive patient care. Because if I see something that needs a different specialty, I don't hesitate. I mean, I can't possibly know everything. In diabetes, we're moving towards a trend that is now becoming global, which is multidisciplinary teams. In other words, to take care of diabetic patients, you'll have an endocrinologist, you'll have a nurse educator, you'll have a dietitian, you'll have a podiatrist. These are all needed to take care of diabetes, because remember that picture from before, it affects so many different areas of the body. So remember, protect your foot health and you're protecting your life. Thank you for watching and thank you for listening.
It was definitely a pleasure. I think I've learned a lot, and thank you so much. I think right now, let's jump straight into the questions. I see a number of questions from Chelsea.
Before there's a question, remember you said to me, because you could see my shelves and my books and things behind me, and I had a shoe there, so I want to show the ladies the shoe.
Please
do. This is something we developed, okay? And the ladies at Transnet are going crazy about it. It's actually a sandal, but it has a steel toe cap. So it is proper PPE, and it is super flexible. and lightweight. I mean, really lightweight. So this is called 𝗤𝗏, and it has Velcro straps. No need to have uncomfortable laces and worrying about laces. You just simply pull the Velcro across. So that's a new invention that has come out. It's called 𝗤𝗏, 𝗤𝗏𝗀, and it comes in size 3 and size 4, and then 5, 6, 7, 8, and whatever. So, yeah. All
I
right.
think I'm with the I think I'm with the ladies on this one. A size 3 and a 4 is very difficult to find. And I
It's
saw
very
Buntu
difficult.
clapping as well. We are suffering. We want proper shoes.
Yeah, no. But that's all part of being put into the correct size shoe. You know, yeah. So what are
Dr.
there any
Anette,
questions? Yes.
yes. Chelsea is asking, in terms of bunions, how do you
Yes.
prevent them from ever starting?
You choose your parents and your grandparents differently. Oh no, sorry, I'm being flippant. Before they become, in other words, if you begin to see a little bit of a slanting, then if you go to a podiatrist and you get them to make you a silicone toe spacer, I'm so sorry I didn't bring any with me. This is my home office here. But they would make you a proper little spacer that re-educates this big toe to get back into place again. But the other thing is, when you're wearing sandals, for heaven's sake, so let me pretend that that's my foot here. When you're wearing a sandal, don't have a sandal where the strap actually influences the sideways movement of that. If you are starting with a bunion, choose sandals where the strap goes over the joint, not in front of the joint, because then you're just going to be moving that big toe across. I've seen so many people who have a bunion and then they wear a sandal where the strap is actually making the bunion worse. The strap should go over the joint. There are night splints that you can buy them online. You can look for a bunion splint and you wear those at night because they are just too bulky to fit inside ordinary shoes. And so you can re-educate that big toe to come back. Because what you're actually doing is you're re-educating the inside muscles of your foot. Can you see what happens? Sorry, let me get this thumb out of the way. You have similar muscles in your hand to what you have in your feet. So if you're able to tighten up that muscle, because at the moment it's overstretched and that's what's causing the bunion. So if you're able to tighten up that muscle, and you do that by stretching the oblique muscle that's actually pulling the toe over. But yeah, it's really sad if you've inherited it. It's your bone structure. In the two bones that meet together at the joint that is the bunion, in most people, there's a little notch on one bone. And so even if there's pressure from high heel shoes or anything like that, that joint doesn't go open. But in people who've inherited the bone structure, this facet is completely round. And so there's nothing to stop it from actually becoming that bunion. So we have to put things in place. You have to put spacers, little toe props. You have to get the right shoes, because when you get the strap across the ball of the foot, not in front of the toes, then it holds that in position and doesn't allow the muscle to become loose again. So yeah, catch it early and do go and see. And also the other thing that contributes towards the bunion is rolling in of the foot. So if you go and see a podiatrist, they will sometimes put little wedges built into your insoles that fit inside there. And we don't make big, chunky, ugly insoles. We make nice, lightweight ones that can fit inside your sandals, that can be moved from your sandals to your work boots. So yeah, I hope that answers your question, 𝗀𝘁.
I'll just chime in here. Thanks, Dr. Thompson. I love this talk. I remember your talk from electromining a few years ago. Yeah, and I just want to say to anyone, I don't have bunions, but I know someone who's had surgery to remove them, and it's just not worth leaving it because it's a very long recovery, and I
No,
don't think you're ever the same.
yeah, I didn't actually mention the surgery. Surgery is last ditch, okay? And it's a long recovery. It's at least 3 months before you're able to walk properly, and then at least a year before you feel that you're back to normal. And you've got to be very careful after that not to rush things, because you can undo it. You can cause it all over again if you're in too much of a hurry to get back into pretty shoes. I know we love our pretty shoes. What can we do?
Yeah.
Yeah, thanks. And then I might as well just shoot with my other questions if that's okay.
That's okay, Charles.
So I've always had an issue with safety shoes. I find them so flat inside. There's almost zero kind of topography inside the shoe. So with someone with a high arch, you know, I feel like that
just hold that thought. Hold that thought. Hang on. I need to show you something. Yeah, is a brand new BBF. It's called, oops, have I got this back to front? Can you read that? That looks upside down. Hey? It says 𝗤𝘁'𝘀𝗁. Okay, so this is called the 𝗤𝘁'𝘀𝗁 Climate Control. And can you see it's got an arch support in it? And it's got cushioning. So that's called a comfort arch. So this is brand new. And it's an accessory. In other words, it's purchased separate from the shoes.
So does it have to be that kind of thing? Is it transferable between shoes, or is it like custom?
Yes,
okay.
Absolutely. But it's mainly intended for PPE. So it's kind of chunky, you know, it's kind of chunky cushioning and that, but that definitely helps. If that's insufficient, then you have to go the custom way, where you have to go to a podiatrist and go and get a custom one made for you.
Okay,
but this is changing things for people. It really is making such a difference, and it has these little grooves underneath it here so that heat is dissipated from it as well. So it's totally, everybody who tries it out says, I want to pay. We've even had people putting them in their hiking boots and going on hikes up mountains and things like that, wearing them. Just, you know,
wow.
We have a couple of people who work for BBF who are very athletic, and so we said, okay, try this and see what happens. And we had one guy who rode a 100-kilometer bicycle ride. I think they call it the 𝗟𝗱𝗃 down in Cape Town, with a pair of these inside his cycling shoes, and he said he never had any pain whatsoever. So yeah, this is what I'm talking about. We need to put a little bit of thought into what we need. Some of us may not need anything extra. You just need a flexible shoe. And that's what we're working towards in the industry. Not all safety shoes can be flexible, because it depends on the task, in other words, and the environment. If you're out in a mine working on rocky, slippery faces where you've got chunky rocks underneath you, you can't be in something that doesn't protect you. So there's a fine balance. We constantly, with the research team, trying to find the sweet spot between enough protection and enabling the foot to function. So yeah, but we're bringing out new things all the time. So that's what's so great about working with BBF. It's a privilege to have a company that responds in this way, completely different to the ones that just bring in imported shoes. Theirs are not even based on the research. I think I don't know whether I did a talk on this previously for Women in Mining, but I went around the country some years ago and 3D laser scanned hundreds of feet. It took me months and months and months. And so those measurements are the database. Those are the South African measurements that are used in the BBF safety shoes. And it makes a huge difference. Most people sort of say, well, yeah, I can feel the difference in these shoes. Why? Because the shape is based on research. So, okay, more questions.
We are sold. And then my last question was on moisture management. How do we know? Because obviously, like, I have never really practiced the swapping your shoes every day, and so obviously, like, some problems arise. And how do you know if it's athlete's foot, and how do you know when it's just like your skin's been rubbing and it's causing a bit of itchiness? Like, how do you tell the difference?
The itchiness is a dead giveaway.
Okay,
Itchiness is fungal. Okay.
Yeah.
So yeah, you need to cut off the water supply because fungus loves moisture. And so one of the best ways in keeping your feet dry and comfortable, believe it or not, is 72-hour antiperspirant deodorant spray. It doesn't have to be deodorant. It's just when you see now Shield or Mitchum or any of those that say 72H, that's 72-hour antiperspirant. And just spray underneath your feet before you put your socks on and that, and then you won't perspire excessively inside the boots. Yeah, there are prescription antiperspirants, but gosh, they are like hundreds of rands, and the 72-hour spray works brilliantly. You can also use baby powder, but I find that actually reducing the moisture in your feet, because it's inevitable. You have to wear your socks and you have to wear your boots, and your feet do feel dampish by the time the end of the day comes. So you want to prevent that. Treating fungal infections of the skin is different to treating a fungal infection of the nail. When you're treating the skin infection, you need to use things like creams, Lamisil cream and Lamisil spray. Sorry if I'm saying brand names here, but we don't have very much choices in South Africa. And the other thing is when you're treating fungal nails, that's when ideally you need to go and see a podiatrist, because what fungus does, if this is the curvature of your nail, fungus gets in underneath and thickens your nail. Not only does it discolor it, but it thickens the nail. And a podiatrist needs to reduce that nail thickness down so that medication can actually penetrate. You would be spending much more money on antifungal medication if you don't get your nails thinned down first by a podiatrist. And yeah, but that's, you know what, I need to do a whole talk just on fungal infections and sweating and all of that kind of thing. So yeah.
Well, thank you very much. Thanks. That's a lot of info. Very valuable.
Maybe just to hop on to one of Chelsea's questions. I don't mean to put you on the spot, but for the orthotics, right? So
yes,
especially the one that you just showed, is it something that we can say
that's not an orthotic? This is a footbed, okay? And
that's a foot pad.
This is just a footbed. Yeah, that's a footbed. Okay. No, an orthotic is something quite different. We can go back to my slides there.
No, that's okay. I'm just looking at in terms of the cost implications, to say,
yes,
because you said you can use a foot pad, but now if you want, something more tailored and
well,
the expense
it's if your body needs it. In other words, there's a fine line between medical and providing. Your employer, unless they have a specific medical aid scheme for you or whatever, they're not responsible for fixing your bone problems or your blood circulation problems or whatever like that. And those might be the things that are causing imbalances in your foot. So then that's the line that you've got to go and get medical treatment. And as I said before, a podiatrist is a medical person. I'm just like an odd one in that I straddle both sides of the fence. 3 days a week I'm in a clinic in 𝗓𝗓𝗃, and the rest of the time I'm working in a shoe factory. So so I'm kind of unusual. But when you hit a medical problem, in other words, if all our best efforts in the shoes and the the commercially available footbeds are not enough to sort your problem out, then you have a medical problem, and you basically got to go. It's no use going to a doctor first and then waiting for the doctor to refer you. You end up spending more money. Just go straight to a podiatrist and get them to assess it. If they find that you actually do need a doctor, that you need some injections or you need something, they'll be the first ones to tell you, look, this is a bigger problem or whatever it is. So that's the story on orthotics.
Another question, would you say that when it comes to, especially in the mining space, right, when it comes to PPE, are they jumping into taking care of the health of their employees, or is it just specific companies? Is it something that they are looking into in the long run, or it's per individual?
I have fairly limited experience. As I said to you, I've been up to Botswana's diamond mines. I've also been out to Namibia, but not actually onto one of the oil rigs. And I know very well a colleague who's been up to 𝗂𝘁𝗄. And by no means is this representative of all of the mines in South Africa. But I do think that the mines are pretty good in doing health surveillance. They certainly test vision, they test for TB, there's lots of things that they do. So I'd hate to be speaking on their behalf, but if any of you have influence, you just need to say, look, the podiatrists are there, you need to use them. The same way as they would, there are lots of my colleagues who go and do a once a month visit to a big company or to a mine or to an area with an industrial area and that kind of thing. And then the people know, okay, if it's really very, very bad, you've got to go off to the hospital. But if it's something that can wait, then they make an appointment through their occupational health nurses or through the occupational health doctor. And then the podiatrist will come along and see to those people. We can usually get through about 15 people in a day, because our appointments are longer, because we're not only examining, but we're also treating. We've got our scalpels out and we're busy scraping off calluses and corns and measuring things and whatever. So it's not like a 10-minute appointment with a doctor who says, what's wrong with you? Oh, okay, I'll write a prescription. Ours are not like that. Ours are longer appointments. So motivate for it. If it's not available as a service, you have to speak up. Now, that was the whole point of my saying, what is podiatry? Because so many people don't know what it is, don't know that it exists.
Oh yeah, I know. I agree with you. I think one thing about 𝗬𝘁'𝘀 is about advocating. So now we need to advocate for our health, our feet. And it doesn't stop there. We need to advocate for our colleagues as well when it comes to the health of their feet. Or maybe just before we end it, one more question. Maybe something more practical that you think we could do tonight for the people on the call to say, what is it that we can do tonight or tomorrow morning, something that we can start doing in order for us to start taking care of our feet?
Go and look at your feet. The way I've explained. No, I'm serious. Go and look at your feet. If we're going to wash our feet tonight before going to bed, please God, just look at your feet with new eyes now. Look at the color of the skin. Look at whether it's flaky or whatever it is. Sometimes, yes, if you do have a problem with dry skin, you can use a foot file or something like that. But do remember that once you've removed the dry skin, you need to hydrate that skin that's underneath. So a good heel balm, okay? A good heel balm would be something that contains a percentage of urea. Now, before anybody freaks out, urea is present in urine, but that's not how they make heel balm. It's made in a laboratory from carbon dioxide and ammonia and all kinds of other stuff. Okay. urea is very necessary to penetrate the hard skin that you have underneath your heels. And so things like, there are so many brand names, but just always try and see whether one of the ingredients says urea, urea, urea. Even, I hate to punt or to promote anybody, but even within 𝗔𝗶𝘀𝗃 themselves, they have their own brand name, 𝗘𝗁, which is a lot cheaper than things like Epimax Plus or Nutra Plus or, all of these fancy 𝗘𝗁s. And those are perfectly acceptable. What doesn't work is using Vaseline, because it doesn't penetrate the skin. It's temporarily feels okay, but within half an hour to 3 hours, the skin is back to being dry again. So 𝗘𝗁s, there is a proper place for 𝗘𝗁, because the skin under your feet and on the palms of your hands, on your elbows and on your knees, no hair grows there. It's a different kind of skin. It's called glabrous skin. And glabrous skin needs a different kind of moisturizer compared to the moisturizer that we would use on our faces, on our legs, and on our body. So yeah, look at your feet. Just examine them. Put your feet down on the floor and take out the inner sole that's inside your safety shoe. Put your foot on top of that inner sole. If your foot is overlapping that inner sole, you're in the wrong size shoe. You need to be in something wider. So yeah, just now examine, become more aware of your feet. And then if you have any of the symptoms that I mentioned earlier, about always wanting to munch something, always being thirsty, needing to go to the toilet frequently and that kind of thing, you might have diabetes. And so, yeah, it's a really simple test. And that is definitely one of the things that we should be motivating, that should be done, should be tested. There are now machines that test what's called an HbA1c. I'm sorry, these things are so complicated. HbA1c. Okay, so it's a hemoglobin type test, which will tell you very, very quickly whether you are diabetic or not. Yes, it costs a little bit, but I think companies should realize just how much they're saving by screening and finding out if people need help earlier, because the amount of money that they invest in training, in work experience and all that kind of thing, to lose a person because they suddenly become ill, there's no questioning in my mind which is more valid. Find out how you can help a person stay healthy and how they can continue to be a working part within the team. So yeah, sorry, it's a bit of a complicated answer, but yeah, become more aware.
No, thank you so much for that.
You're most welcome.
I'd like to check if there's one more question before we close. I'm not seeing any hands. I'm not seeing any questions. Well, with that being said, yes, I thought you wanted to say something.
We're just looking in the chat. Yeah, no, I don't see anything more.
Yes, no, I also don't see anything more. But with that being said,
there was just one comment there where someone said orthotics are quite expensive. Yeah, and one usually has to do a set for each pair of shoes. Not true. The podiatrists now are able to make a pair that can move from shoe to shoe, and we use Velcro underneath them. So you can have Velcro in your sandal, and you can use the same orthotic inside the sandal as moving it back into your safety boots. So at least you have one expense, and usually medical aids will pay for one set per year, depending on the plan.
That's quite
depending
informative.
on your plan.
I also thought
if you're only on a hospital plan, then they're only going to cover you for hospital stuff. So then it becomes difficult. Then the money that you're saving each month on only being on a hospital plan, you need to put some aside so that you can end up paying for an orthotic or for something else. So
No.
Thank you very, very much. Thank you for having me. And yeah, you can tell I'm passionate about feet. That's all I want to do is make everybody comfortable.
No, we're glad you want to make us comfortable. And thank you so much for availing yourself. I think we've learned a lot. Homework to all of us. Go check your feet. I'll be checking mine. I know I already have issues with my legs, so I need to start somewhere. And as we close, I think the one thing from me today that I learned, take care of your feet, you know, go consult, find help. And the other thing is also to advocate, advocate for your workspaces, advocate for your colleagues, advocate for a better design, a better feet, and a better health. So that is something that we all need to take home with us today. And with that being said, thank you so much and have a fabulous, fabulous evening.
Okay. Take care. God bless. Bye.